When a patient presents to me for breast enhancement, oftentimes the number one biggest decision that we have to make is, does this patient just need augmentation, or do they actually need what we call mastopexy, or a lift? So I've always not liked the term mastopexy because I never knew what it meant before I became a surgeon. And I also don't like it from the standpoint that you can't really tell what the procedure is by that word. Also, lift seems to underassign the seriousness of this procedure. So if a patient doesn't just need some volume, but they actually need some tissue rearrangement because they've become droopy, then the lift is the procedure for them. Now let me describe that procedure. I oftentimes describe that procedure to patients as a slice and dice. Sorry, I know that sounds a little non-professional, but I think it gets the point across. This is a procedure that represents significant tissue arrangement. And if you need it, you need it. You never ever should avoid a lift when it's clearly the procedure that you need. Now, I have had patients who are clearly middle of the rotors, and my percentage rate of those patients being happy after an augmentation only, if they meet my rules, is extremely high. It's been very gratifying to see patients who've been told by 3 different surgeons, you must have a lift, and for me to be able to say, well, you know, you really do meet the rules for somebody that seems like you'll be happy. Let's walk through that. And my patients have absolutely been happy when they've been middle of the rotors if they meet the rules. So that's something that we can only determine when we sit down. Sometimes I can actually look at photos that are submitted and can tell whether a patient clearly has the option or not. So a little bit of a description of a lift, mastopexy, slice and dice. This is a procedure in which normally an implant is also placed. Why? Because for that breast to really have a pretty shape, it just needs to have at least a small implant, even if a patient isn't looking for additional size. If they're very, very oversized and they're in need of a reduction, that's a whole different reconstructive thing that we can talk about later. But in this case, we are now doing lift augmentations with a small implant and a reduced incision size. Now, don't think that you can go for some of these minimalist procedures where we can sort of do a lollipop or do a donut type of a lift or a crescent mastopexy. In my experience, all these said procedures fall very short in giving a long-term result. So my recommendation is almost always to go for the anchor type scar with a surgeon who knows how to minimize those incisions. That way you get a maximum result, minimum scars with the maximum longevity of this excellent result. It's a very fun procedure to kind of plow through and help my patients understand something that's actually quite complex. But we'll go through photos of actual intraoperative representations of the photos so you can understand exactly what we're doing, why we're doing it. One last thing. I have found that in this procedure, if the surgeon does not commit himself to a significant reduction of tissue in the lower pole of the breast, the result will be really good above the bathing suit line. But when the patient gets out of the shower, looks in the mirror, the bottom of the breast can be somewhat boxy. So with very, very little risk, a patient can have a much better result by making sure we sculpt that bottom of the breast along with the upper pole enhancement, which comes just from the implant. So that's a procedure that we really pride ourselves in. We have advances, and you should not go for any other options if that's the right procedure for you.